Hi, welcome to Ask Dr. Tan. This is a series where we take a question from the web and then we try to answer them the best we can. And for this week, our topic is on testosterone deficiency. So the first question that we got, the commonest question is, what is a good level of testosterone? Okay, so Singapore labs, we use a unit which is nanomoles per liter to measure testosterone. You'll notice this is slightly different from US labs. Now, using this unit, according to local guidelines, a testosterone of under 8 nanomoles per liter is considered very low and requires treatment. Above 12 is considered normal and not requiring treatment. 8 to 12 is kind of a grey zone where the doctors will look at your symptoms and discuss with you your outcomes of therapy. Now, that said, the European Endocrine Society guidelines did report that patients with testosterone from 16 and under actually will start showing symptoms like low libido. So at the end of the day, the diagnosis of low testosterone syndrome shouldn't be based on just this one number of your level of testosterone. It has the patient has to be taken into account. So like how bad your symptoms are, whether you have any other indications of low testosterone like osteoporosis. So please discuss this with your doctor. The testosterone level is just one aspect in the diagnosis. So the second question is, should it be pegged to age? Oh, that's a very interesting question. I'll answer it slightly differently. So there's a huge inter-individual variability among patients for testosterone level. In other words, I might feel great on the testosterone level of 12 and you might not feel so great on the testosterone level of 12. So rather than pegging it to age, we again look very holistically at the patient, at various clinical signs and symptoms, as well as other diseases, and then we make an overall decision on whether or not the T level of the testosterone level is appropriate for the patient and whether or not he needs testosterone replacement treatment. And the last question is free or total T? This is a very interesting question. So we've always been talking about total testosterone. So this test measures the total amount of testosterone in the body. The problem is a lot of this testosterone is actually stuck onto protein. And when it's stuck onto protein, it's actually not available to the body for use. So what some of us do, some doctors do, is we calculate out what is the amount of free testosterone that the patient has, the amount of testosterone that the patient actually can use. And this might be a better indication of how much testosterone is actually in the system. So according to local guidelines, we only use total T to monitor the patient. We don't use free T unless the patient has all the symptoms of low testosterone, and then the total testosterone does not really reflect the level of symptoms. So patient has very bad symptoms. When we measure the total testosterone, it looks kind of normal. So what we do is we measure the free testosterone, and then sometimes we find that to be low. All in all, please consult your doctor to interpret these numbers for you properly. This brings us to the end of this episode. I'll see you guys next time.